Coaching for clinical leadership. Clinicians are backbone of every healthcare system. However, many times they lack the enthusiasm or initiative to come to forefront for making the difference. In real life, clinicians should be playing a central role in making the changes in the healthcare system. They can design the system to offer better outcomes, greater ease of use, lower cost, and more social justice and health status. Instead, most of the proposed changes that are today called healthcare reform are actually changes in the surroundings of care rather than changes in the care itself, and are driven by managers. Clinicians have an opportunity to exercise leadership for the improvement of care, but they must have enough understanding of the system and the confidence to make the changes. The clinical leadership is this ability of understanding, driving and having confidence to bring the changes for cost-effective and quality care. Clinical leaders must first agree to address the aims of reform and to adopt an agenda of specific changes in their own work that are likely to meet the social needs driving the reform movement. Coaching helps the leaders to look inside and outside before launching into change of the changes. All humans are emotional beings, and if emotions, values or personal dignity is violated, hypothalamus and other emotional centers of the brain are triggered and agitated. These then constantly act against the changes suggested and create the issues which go round and round, making the change difficult to implement. This is the underlying mechanism of change failures. The commonest problem in healthcare organizations is systems incompetence and systems failure. All leaders are risk-averse and therefore incompetence survives. I can help individuals and teams to develop drive for discovering spots of incompetence and eradicate ineptitude. I can help bringing alignment of individuals' value with team and organization's values. I can bring spark and motivation in clinicians to take effective leadership role. Health services research offers a sound scientific basis for identifying promising improvement aims for clinician-led reform. This will allow the clinicians to embark on the journey of addressing 11 areas described by Donald Berwick. Reducing inappropriate surgery, hospital admissions, and diagnostic tests. Reducing key underlying root causes of illness. Reducing cesarean section rates to pre-1980 levels. Reducing the use of unwanted medical procedures at the end of life. Simplifying pharmaceutical use, especially for antibiotics and medication of the elderly. Increasing active patient participation in therapeutic decision-making. Decreasing waiting times in healthcare settings, reducing inventory levels in healthcare organizations. Recording only useful information only once. Consolidating and reducing the total supply of high-technology medical and surgical care. Reducing the racial gap in infant mortality and low birth weight. These are some of examples of providing good cost-effective patient care. It will bring the laurels to the organization you work in, and also give you inner peace of really improving patient care. With coaching, you can see big picture and have future vision that would have been elusive and indistinct. You also have focus, bite-sized chunk of plan to act, and a drive to make it happen. You can have aha moments and breakthrough. Don't wait longer.